This video is about Chapter 9, Articulations, Part 1. Chapter 9 is about joints, and so I'm going to be talking about what are joints, how are they classified, and what is the amount and type of movement they allow. So let's start with the definition of a joint. A joint is where two or more bones connect. Also called articulations. So the word joint means the same thing as articulations. Articulation, by the way, is a noun. However, we could also use the word articulate. Articulate means to connect. And this is actually a verb. So the words are mean a little different. I mean, to connect, joints connect, but there's a difference. Articulate, again, a verb. To connect, articulation means a joint. What is the role of joints? One of the roles is to allow the skeleton to move. So bones are fairly stiff, but the joints allow movement between bones. The other purpose of joints is to hold bones together. There are many joints in the body. So in order to make sense of them, scientists put them in categories based on either their structure or their function. One group of categories is based on their function. In this category, joints are classified by how much movement is allowed. Now, there are three categories you can put a joint in terms of its function. The first is called a synarthroses. These are Greek terms, by the way, so they're a little tricky to say, but synarthroses means an immovable joint. So this joint, for the most part, does not move. And these are found in the axial skeleton, where you really don't want to have a lot of movement. Another category, amphiarthroses, are slightly movable joints. These are also found in the axial skeleton. And lastly, we have diarthroses. Diarthroses are freely movable joints. These are found mostly in the limbs. And remember that the limbs are part of the appendicular skeleton. Now, a couple of things about these categories. Synarthroses, amphiarthroses, diarthroses, these are nouns. However, you can use them as an adjective. So if you wanted to describe a joint that belongs to this category, you can say it is a synarthrotic joint. So again, this is an adjective because it's describing a noun, synarthrotic. Or you could just say it's a synarthroses, which means it belongs to that category. Likewise, for amphiarthroses, you could use it as an adjective by saying amphiarthrotic joint. Okay, so again, describing the joint, or diarthrotic joint. So you can put all of the joints in the body in one of these categories. The most common is diarthroses. Okay, that is the most common category. Now you can also put joints into categories based on their structure. And joints are classified by their structure in two ways. One is by the tissue that connects the bones. The other way is by whether there is a joint capsule presence. So presence of a joint capsule. And what I mean by that is where the two bones connect, is there a capsule going around the connection? Yes or no? There are three categories of structural classification. There are fibrous joints, cartilaginous joints, and synovial joints. So let's start with fibrous joints first. In fibrous joints, bones are connected by fibrous connective tissue. And again, I'm going to write CT for short for connective tissue. There are three types of fibrous joints. There are sutures, gomphoses, and lastly, syndesmoses. Okay, so again, a fibrous joint is when the bones are connected by fibrous connective tissue. There is no joint capsule. So let's take a look at the fibrous joints here, and we're going to move down here. And we said there's three types. The first type is a suture. So a suture joins sutures join the bones of the skull. They are often called seams because they look kind of like the seams that people use when they're sewing, and these are immovable joints. Let's take a look over here to this picture on the left, and when you do the axial skeleton lab, you will see these sutures, but you can see here we have the coronal suture, which separates the frontal bone from the two parietal bones, sagittal suture, lambdoid, be careful there's a D there, lambdoid suture, and then there are squamosal sutures on the side, but you can't see those. So again, sutures join bones of the skull. They are immovable, and the purpose is to allow the brain to grow in children. Now keep in mind that these seams are made of fibrous connective tissue, and in children they are wider apart. So the sutures are not as close together. And in certain places, they are fairly wide apart. So for example, right about here, this suture is about that wide. And also on the sides. And they call these fontanelles in children. That's a word that people often use. Or some people just say the soft spot. But the reason it is so wide here is because the brain is growing. And so the nervous system grows a little more slowly than the skeletal system, and the wideness of the suture here allows the brain to expand. If you ever press gently the soft spot in an infant's head, you can actually feel the blood vessels contracting and expanding on the surface of the brain. So the brain is very vulnerable in this area because there's no hard bone protecting it. In adults, these sutures come closer together. And so in adults, what the joint does is help protect the brain. Okay, so a suture is one type of a fibrous joint. Another type is called a gomphoses, and this is the joint between the tooth and its alveolar socket. So you will see when you look at learn the bones of the skull, that there is a little socket that the tooth fits into. That's called the alveolar socket. The tooth is connected to the socket by fibrous connective tissue. Now, this fibrous connection they call periodontal ligament. So remember, ligaments connect bone to bone, and believe it or not, the tooth is actually not a real bone. It is another type of connective tissue. However, they still call the fibrous connective tissue a ligament. And periodontal is probably a word you've heard if you've ever been to the dentist. Now, the last type of fibrous connective tissue is called a syndesmoses, and in this one, the bones are connected by longer fibrous connective tissue. Longer. longer ligament. And the amount of movement depends on the length of the fibers. So the longer the ligament, which is made of the fibrous connective tissue, the more movement. The shorter the ligament, the less movement. And if we look down here, you can see an example of a syndesmosis. So here we have the tibia. This is your shin bone. You can see up here. The tibia is always medial. It's always on the inside. Here's the fibula, which is always lateral. And your ankle bones, the tarsals, would be here. So here's the ligament. This is actually the syndesmosis, the joint. It's made of fibrous connective tissue. And the movement of these joints in general vary from slight to immovable. So even though there's longer ligaments, you get more movement, it's still a slight movement. Now this joint here is called the tibio-fibular joint. And there's a clue in the name, tibio, tibia, fibula, fibula. Now there's two places where the tibia and fibula come together. This one is called the distal tibio-fibular joint, because it's far from where the bones connect to the body. And this joint is fairly synarthrotic, which means, remember, that means it's immovable. Although, if you point your toes to the sky, so remember your ankles are here, you do get a slight movement, but it's not enough to be considered a real movement, so they call this a synarthrotic joint. Okay, so again, we're talking about the structural categories of joints, and we said there are fibrous, cartilaginous, and synovial. And we're talking right now about the fibrous joints, and there are three types. There's a suture, a gomphosis, and a syndesmosis. So let's move on to the next type of structural category, which is cartilaginous joints. Cartilaginous joints are when bones are connected by cartilage, and there is no joint cavity. So there are two types of cartilaginous joints, a synchondrosis and a symphysis. So here you can see chondra. Remember, that refers to cartilage, so that's a big clue for you. In a synchondrosis, the bones are connected by a bar or a plate of cartilage. And this is hyaline cartilage, I should say, by hyaline cartilage. That's kind of important. These joints are synarthrotic. So remember that that means they're immovable. Here's two examples of synchondroses. Here we have a wedge of hyaline cartilage. Okay, and so this is a wedge, a bar or a plate, and it's called the epiphyseal plate. You remember learning about this in chapter 6. This is only found in children, so it's temporary, because remember, it eventually turns to bone, and then it's called the epiphyseal line, right? Synarthrotic, no movement. Here's another example. It's between the first rib and the sternum. Okay, first rib and the sternum. And blue, remember, blue is the color they use to indicate hyaline cartilage. So this is immovable. However, the joint between the other ribs and the sternum is not a synchondrosis. So you might say, well, why is that? Because they all have cartilage connecting them to the sternum. It's costal cartilage. And I would say, yep, you're right, except they can't be cartilaginous joints. Why couldn't they be? So think about, again, the fact that these joints are synarthrotic. If you sit and take a big breath right now, the biggest breath you can, you will notice that your ribs move up and out. And this couldn't happen if the joint here was a cartilaginous joint, because it would be immovable. So it just so happens that the connection between the other joints, so we still are going to have hyaline cartilage here. We have the hyaline cartilage in here. Well, let me change. But right here, we are going to have a synovial joint. So it just so happens that the joint between All the other ribs besides rib number 1 and the sternum is a synovial joint, which allows movement. Okay, so the other type of cartilaginous joint is called a symphysis. And a symphysis is when the bone is connected by a pad of cartilage. And this pad contains fibrocartilage on the inside and hyaline cartilage on the outside. Okay, so this is called a symphysis. These joints are amphiarthrotic. Okay, that means they allow a little bit of movement, and they're really designed for strength and flexibility. So let's see if I can show you what these joints look like. There are two examples here, right down here, the intervertebral discs and the pubic symphyses. So in the middle of the disc is fibrocartilage. So we're going to show fibrocartilage as red here. On the outside of the disc, blue. Imagine that there's red on the inside, blue on the outside. Blue is for hyaline cartilage. And so that's what these wedges are like. Now remember that there's a lot of there's a lot of collagen in these discs. Fibrocartilage have lots of collagen. And as a result, these are pretty strong joints. However, there's a little bit of flexibility. Now, if you look at the pubic symphysis, you've got all the weight of your body pushing down on this joint, so it's got to be strong. It does allow a tiny bit of movement, hence amphiarthrotic.